happening in each state. Oh, thank you for recording. So as we go through that piece, we would love to kind of kick off today with a poll and hear from you all about kind of those priority areas for veteran oral health in your state. So Rahel's going to launch a poll asking you what you see as priority areas for veteran oral health in Kansas. Is it access to care? Is it oral health literacy, workforce development, policy advocacy, integration with general health care? So we'll give folks a minute to do that as we're going through these intro pieces. We'll go to the next slide as folks are answering that poll. And I'll just touch on a few brief housekeeping pieces. This session is being recorded, as y'all just heard that announcement. Slides, forms, materials from this session will be posted on our website after this call. We invite you to share your name and email organization in the chat for an introduction. Again, this is really a discussion. We're excited to hear from everyone, you as stakeholders and oral health in your state, about what's happening and to share kind of ideas and collaboration pieces. And if you have questions on Zoom or need a technical issue, please pop that in the chat as well. I can assist you, or my colleague Rahel can assist you as well. So I will pause and take a minute here. I see that poll sliding in. That's looking great. And what we're going to talk about today is we're going to analyze state-specific veteran oral health data to identify key disparities and challenges using critical thinking skills to inform advocacy efforts. We'll be able to evaluate existing policies and advocate for reforms to bridge gaps in veteran oral health care access, employing a strategic approach to policy change. We'll be able to collaborate with local stakeholders to develop data-driven oral health advocacy plans, fostering teamwork and coalition building. And we'll be able to formulate evidence-based strategies for utilizing the knowledge gained in the session to advance veteran oral health in your state, demonstrating the application of acquired knowledge in real-world scenarios. So we can head on over to the next slide. We're saying that the speakers don't have any conflicts of interest today or no disclosures. And who do we have here today? Annalise Cawthorn is the Executive Director of AIDPH. I introduced myself, and Tanya is here as well. And we just want to say a big thank you to Oral Health Kansas for facilitating this call and making this happen, and really being the folks who brought everyone here today. So thank you, Tanya, and thank you, Oral Health Kansas, for letting this happen today. And without further ado, Annalise, I'm assuming you can kind of see the poll here and share out those pieces. I will pause and hand it over to you to take over there.
Thanks, Liz, and hi, everyone. We're so excited to be here today on our Kansas stop for our virtual road tour. And our intention here today is to do about 30 minutes of chatting and sharing information, and then we would like to do a lot of listening and hearing what you need in terms of stakeholders who are doing this work every single day. We feel like that's really critically important to this process. And part of what we'll share here today is we've done a lot of research and a lot of learning. And now at this point, we really want to hand all of that over in a way that's tangible and actionable to states, and not do the work of states, but just give resources to states to continue doing their work in the way that they know how to do it, and continuing the relationships and engagement that they have already created in their own respective communities. So part of hearing back that process is learning what's important to all of you. And I'm sharing the results of the poll, hoping that you all can see them. And what I'm seeing here around these priority areas are number one, access to care, which is great. We're going to talk a lot about access to care throughout today's discussion. And then integration with general health care, which is wonderful because we will also talk about some of those crossover conditions and why it's important to think about veteran oral health in an integrated and holistic way. So without further ado, I want to give a little bit of background about AIDPH in case you've never heard of us or have not stumbled on our website. That's okay. We are a national 501c3. We're here to empower our community to advance oral health through science, education, and advocacy. And that's important because that's exactly the tactic that we've taken within our veteran oral health portfolio, is really using our research to drive education and advocacy initiatives. And that's part of what we're doing here is in that education and advocacy space as we pursue our vision of a justice-oriented oral health system. So AIDPH specializes in 4 core communities of focus, one of which is veterans, but also includes people living in rural areas, people with disabilities, and LGBTQIA plus people. And I also mentioned that because we look at the intersection of those areas too. And what you'll learn here today, we have a really large focus on rural veterans. And specific to Kansas, we know that Kansas has a lot of rural areas. So we like to understand those crossover areas and those intersecting opportunities to really figure out education and advocacy as we're coalition building and issue building. We also just want to thank CareQuest Institute for funding this work. We have had a partnership with CareQuest Institute now on veteran oral health for quite some time. So really our journey around veteran oral health started in 2021 when we were looking at this issue of veteran oral health. And CareQuest actually approached us and said, what do you know about veteran oral health? And outside of my own lived experience, being the wife of a veteran who's a Purple Heart recipient, being a beneficiary of the military healthcare system, despite having a lot of lived experience, I actually said, professionally, I don't know what's happening. Great question. And what we found was that all of the information really that existed on veteran oral health and understanding outcomes and potential disparity could fit on one piece of paper. And that was really a true call to action to say, well, if we don't know enough about this topic and no one else is focused on it, it's really up to us to start figuring it out. And so throughout 2021, we actually partnered with veteran service organizations like the VFW, Minority Veterans of America, Disabled American Veterans, and we started surveying veterans and asking them, what is your experience like with oral health? We looked at publicly available data sets like NHANES and Burpus and started really culling through that data to call out specific insights around outcomes. And so the work that we're doing here today is a result of about 2 years of research and a dedicated discovery process of figuring out what is going on with veteran oral health. And that's why we're here now at the state level to help present that information and really make it tangible and actionable for all of our state level partners. And so we have to start with what veteran oral health actually looks like nationally. Because I think there's a common kind of conception here that veteran oral health and all healthcare is really handled through the VA system. And that is true in part in that most primary care for veterans is happening in 2 places. So maybe 3 places. So one potential area where primary care is occurring is in the TRICARE system or the military benefits system. So that could be if you were active duty and you are now retired and you still have access to that, you can go onto a military base and receive benefits, and that's administered through the Department of Defense. You could also get care in the private sector, like a civilian. So you can get employer paid benefits and just sort of interact in the healthcare system as a civilian would. The other option is for your care to be administered through the Veteran Health Administration, and that is administered through the Department of Veterans Affairs. All of those medical care eligibility guidelines are determined by federal code, and it's important because changes made to that system are 2-part. There has to be a change to the language in the federal code, and then there has to be a budget associated with any expansions of eligibility. And so what that means is that Congress really has to be involved if there are changes or any sort of increases to what the eligibility guidelines are for any type of medical care to include dental care. And so of the 20 million veterans, if you don't listen to anything else I say here today, this is the most important thing for you to take away, is of the 20 million veterans here in the US, about half of them are currently eligible to receive primary care through the VA. And so if you're looking at this entire bar, This would represent all of the veterans in the US. And the darker blue, maybe the medium color blue, represents all of the veterans who are eligible for care in the VHA. And when we're talking about dental care, that tiny dark blue and red area represents the number of veterans who are eligible for dental care through the VA. So about 85% of veterans are walking into a medical care appointment and potentially walking out with dental pain because they cannot get their care treated through the VA because of those congressional eligibility guidelines and the fact that they can only be changed through congressional action. That tiny red bar that you see at the very end are the number of veterans who are eligible and utilize that benefit, which winds up being less than 15%. So about a third of veterans who are eligible for that benefit utilize that benefit. And we don't know why. I can make lots of guesses and assumptions. It's probably difficult to get care. It might be confusing to understand where your benefits are. It's a great question. But the takeaway from this is lots of veterans are not getting care through the VA. And because of that, we really have to understand what the disparities and outcomes are as a result of this complicated access to care. So when we dug into that question, what's happening with veterans who aren't able to access care in the VA, we looked in this kind of integrated space, which I'm hearing from all of you here that this is a priority area, and I'm so glad that it is, because this is really critically important. When we look at those veterans who are going into the VA with chronic disease conditions, now this is not specific to those veterans only in the VA, but this is part of our survey work that we actually looked at. We looked at survey work and we looked at publicly available surveillance system data. And we found that, one, veterans have a very high prevalence of chronic disease conditions, particularly diabetes and heart disease, and this is nationally. We've also seen that veterans with diabetes are actually, and veterans with heart disease are a little more likely to be seen at the dentist, like they're more likely to have gone to a dental visit, probably because they're used to accessing that care. Unfortunately, they're also far more likely to lose all of their permanent teeth. So the access piece isn't necessarily translating to effective oral health outcomes. And in fact, even after controlling for factors like income and education and rurality, veterans with diabetes were 40% more likely to lose all of their natural teeth compared to veterans without diabetes. We see that same effect with heart disease. Controlling for all of those things, so basically taking it out of the equation, taking income, education, and rurality out of the equation, veterans with heart disease are still more likely to be a dentalist than veterans without heart disease. And we focus on this because when we're doing advocacy and we're making these policy recommendations, not only is this about quality of life, so losing all of your natural teeth is a result of a really, well, can result in poor quality of life. It's also expensive to manage those chronic disease conditions. And part of our research focused on this cost of care. And so by offering more effective healthcare and expanding in an integrated environment, our research indicates that for every dollar invested for veterans with diabetes and more effective dental care is $1 saved. So it's a one-for-one kind of straight shot here. And in fact, for veterans with heart disease, because that's such a costly condition, that for every dollar spent, $2 is saved. So an expansion at that point is paying for itself. And really, at the end of the day, this is resulting in billions of dollars in savings. Now, pay attention to this piece about prevention saving money, because this will come back up later. It's really important to think about in this holistic and integrated environment when you're making education or advocacy kind of calls to action, that saving money is usually at the top of everybody's list. And so I just want to point out too, we have a lot of research that we've done over the past couple of years, and it's not all state specific. It really is at the national level, but these are kind of insights and inferences that you can use to talk about what's happening in your state and like the national kind of context and landscape that veterans are experiencing. We also have just lots of different types of information. So some of it is on cost of care and pain, some of it's generally on access, and we do have some special focus on rurality. And so from those pieces of research that we publish, we also try to pair that with interactive resources and tools, which is what we're doing here today. Two things that you'll find on our website, one being this dashboard that'll let you engage in different pieces of information for your state, and also drilling into access points within your state, so FQHCs and VA locations. But we've also paired those with state-specific profiles, which is what we'll review here today, and looking at how your state compares to other states and how veterans in your state may compare nationally. So let's get into it and look at what's going on with Kansas veterans. So you can find your state profile through the link. I think we've put it into the chat. Okay, Liz is saying yes. So you can find your Kansas state profile in the chat. We encourage you to bring it up and look through it now and start considering the state-specific insights that may come to mind for you. And we've designed this to be hopefully easy to understand and pull insights from. At the very top, you'll see an outline of your state and the density by county for your state of where veterans are located. And then we followed that by kind of a list of quick facts to include rurality, which, as we mentioned, we have a heavy emphasis on rurality, and I know that that's important to Kansas. So counties in Kansas that have the highest veteran population include Gary, Clay, and Leavenworth, and about 8.6% of the entire state of Kansas, 8.6% of that population are veterans. We've also created just some kind of double clicking on some of these oral health outcomes related to veterans. So one being what we've already talked about, which is edentialism. We've also looked at those chronic disease conditions for a few different reasons. One, because we know that those chronic disease conditions exacerbate poor oral health outcomes for veterans. But two, we know that investing in managing those chronic disease conditions can also result in cost savings. So that's why we really wanted you to have the information right in front of you to pursue whatever state-specific insights can inform your practices, your decision-making, and how you advance oral health equity for veterans in your state. So here we compare Kansas to national percentages and averages. So, and all of that kind of comes back into a ranking system. So ultimately, what does this mean? How does Kansas compare to other states? So those state rankings across those conditions, where the higher the ranking, the worse the condition. So kind of looking at all of these, the highest that Kansas got is that it's number 7 in uninsured veterans. So that's not dental insurance, it is medical insurance, but those are the kinds of insights that you point out, and you can look at, you can talk to a decision maker, or you can look at care delivery sites and say, you know what, this is probably something we want to work on. How could we work on that together? We also put together a report card. I know that we all understand what report cards are, having gotten them for a lot of our childhood. And really, this was meant to be a conversation starter, an easy way for you to see where you're at right now at baseline and to say, again, how can we improve these things? So, looking at Kansas's report card, Kansas got a D in diabetes. So it's poorly managed right now in Kansas and a high rate of diabetes. So that gives you a metric to say, how can we improve it? How can we decrease the percentage? How can we increase our grade? And right now, our overall grade is a C in Kansas. You can also see what the technical process is behind where we got this data, and also how we put together the grading system on our website. So if you're ever asked that question, how did you arrive at this? We have it all spelled out on our website in our technical information guide. So how can you use this profile? Well, at the end of the day, you know how to use your profile best, but we wanted to give you some ideas or suggestions for how to use this information, starting with advocacy. And you know what? It didn't look like that on my slides, and it just did now. So I'm sorry that the wording is kind of mixed together here. But starting with advocacy, and advocacy can be policy advocacy, it can be big P policy, or it can be little p policy. So how are you looking at care delivery? How are you thinking about best practices? How are you just approaching an education and a visibility and awareness for veterans and their oral health? And that's really what this tool is designed for, is to give you resources to be able to have those conversations with the decision makers and stakeholders that you know best in your state. Secondly, it's that education piece. So we've tried to make this tangible so that you can take it to a wide variety of audiences and they can really quickly get information without having to do a lot of parsing or thinking. It's a really simple way of sharing what the snapshot is right now in your state on veteran oral health. These can also be tools for decision making. So what counties should we focus on? What areas or interventions we should focus on? What makes the most sense? Where are we seeing our gaps? What information do we not have and we really need to pursue? So hopefully those can create questions. It can also create some guidance for you to take and use. Lastly, reports and grants are a great way to pursue additional action around veteran oral health. And I'll show you an example of one state who's really gone in depth on the reporting side. But on the grant side, I just want to note too that CareQuest Institute has an RFP right now to expand oral health equity for veterans. So if you're interested in using any of our data to support a grant application, we would love to see Kansas on the map there. And we really want to democratize action. You know, AIDPH has been leading this effort, and we're so thrilled and honored to do that. But we want to make sure that we're supporting other states and other leaders who are doing good work to expand the work that they're doing in veteran oral health. So this is an example of a state that really went in depth on what to do around veteran oral health, and recognizing there were a ton of gaps, really wanted to showcase what it could be like to understand where those gaps are and also to make strategic recommendations. So we're highlighting Iowa. We were really thrilled to be able to create this report for the state of Iowa, a really comprehensive data intensive report, kind of a state of the state, almost like a state oral health plan for veterans in Iowa. And so it started off with an overview of Iowa veterans and oral health outcomes in Iowa for veterans. But really, the pieces here that folks find the most interesting and actionable are those strategic recommendations that came from those data-driven insights. So there are recommendations for policies, for care delivery, for researchers, for advocates, for professional associations. And that I'm highlighting that because this is, one, a really great report. We're proud of it, and we're proud of the state of Iowa for going in and taking such a comprehensive look at veteran oral health. But two, there may be insights that you can apply in your state. So as you're thinking through all of those actionable pieces with your state profile, we really want to highlight this Iowa report because it may be able to be an extension of some of the work that you're doing here in Kansas. And so with that, we'd really love to move into our discussion session. So Liz, I'll turn it over to you, but we can also take some quick Q&A before we go into that, if that's what you'd like to do.
Yeah, great. Thank you so much, Annalise. So I will pause before we jump into the discussion questions and just see if we have any questions about what Annalise posted. I know there was at least one in the chat. Let me see if I can just scroll up here. My chat is jumping for a minute. Tanya was saying that she's curious about the rate of uninsured veterans and if it could be a high rate as a result of not expanding Medicaid in Kansas. So at least I don't know if you have thoughts there. And I also invite the group again as experts in your own state to jump in on thoughts on Tanya's and wondering about those pieces.
You know, that's a great question. It certainly could be. I believe that all of those data came from the behavioral risk factor surveillance system, which is, you know, a publicly available data system that we took and analyzed on the state level. So ostensibly the why isn't there, but I think there's a connection that can be made. Tanya, is there anything else that you want to say about that, about why that sparked in your mind?
Well, we're not a Medicaid expansion state. It's top of mind right now. There's rumors of a Medicaid expansion hearing coming up in the legislature next week. It still won't pass. There's like zero chance. And so it's a really, really big hot button issue. But I'm embarrassed to say I don't have any data in front of me that the Kansas Health Institute annually puts out an insurance report that describes the insurance status, health insurance status, not dental, of all Kansans. And we, routinely rank pretty low in terms of adults with insurance because Medicaid has not expanded. I would say, just as a fun fact, we worked with the Kansas Health Institute about, gosh, I think it's like 3 or 4 years ago now, to put together a report that showed the dental insurance status of Kansans, which was really interesting. But this is the time of year, in other words, that the Kansas Health Institute study comes out, and then the Medicaid expansion is just top of mind. So I feel like we generally look bad compared to the rest of the country in terms of coverage because of expansion. But I also don't, I mean, I feel like I'm new to the veteran space. I've learning a lot from you, but I don't know enough about how veterans might be covered. I know you certainly talked about, TRICARE, or certainly the VA. But I know there's probably plenty of other veterans who don't have any of that and just, use private insurance or don't have it at all.
Yeah, one thing that we did with the Iowa Veteran Report is that we did request the number of veterans enrolled in the Medicaid system through the state. And that was a little bit challenging to get a hold of, but as a data process point, it feels like something you could at least FOIA request is to see, how many veterans are enrolled in your state system. I don't know how to get how many veterans are enrolled in Medicare because that's a federal program, but I would be super interested to see that. One interesting point when we did our survey work, so there's, some BRFIS data that's available publicly to anybody. And then we surveyed just over 2,000 veterans through our veteran service organization partners. And when we asked folks about their insurance and where they were getting care, it was about a third. So a third were, just in that sample size, it was about a third were kind of in the private sector, a third were in the VA, and a third were kind of in the TRICARE space. And what struck me about that data, hearkening back to that kind of initial data point that I shared around how many veterans are eligible and not utilizing their care, is that 42% of veterans didn't know if they were eligible for dental care. So of that 2,000 plus sample size, a really large percentage of veterans, I think, are struggling to access and navigate the current system. And so that doesn't require any money or congressional changes to just say, we want to help veterans get into the care that they actually are eligible for. And we'd like to do that in our state, whether that's through Medicaid, whether it's through the VA, et cetera. I think there's an opportunity there outside of just expanding insurance, is getting veterans into the care that they're already eligible for.
Okay, great. I will invite any more questions as we're moving into discussion. We're either chime in on the chat or just pop in here. And as we're moving into discussion piece, please, I welcome everyone to come on camera, excuse me, as you're willing and able, so we can have a great discussion space here today. And I'm going to pop these questions, our discussion questions, in the chat as well. So Annalise, you can feel free to post those on the next slide and keep them up, or we can pull them down so we can kind of see each other better. So the first question that we wanted to talk about today excuse me, are what success stories of veteran oral health policy, programming, or advocacy that's happening in Kansas. Again, as you all in your state and stakeholders and the folks who are there, we would love to hear excuse me, success stories. So I will pause and let folks jump in with those pieces.
Also, feel free to reflect on the other questions too, if something more readily comes to mind.
Yes, I was also going to add success stories would be wonderful, or if something was attempted and a challenge was raised or a barrier was encountered, please share that as well. And I think we have mentioned, but this is part of a program we're trying to do nationwide. We're trying to get to as many states as possible with this information. And as we're partnering with folks, as we did with Tanya, what we're hearing a lot is states are really curious about what other states are doing and what people are finding successful. That's kind of one of the first questions that people are asking us. So we're really working to kind of pull these stories and these resources together at a compendium at the end of all of this, that folks like yourselves can kind of go back and see what other states are doing and get information from there.
I'm hoping others will weigh in, because I just say, like at Oral Health Kansas, I think I can say pretty safely, and many of my colleagues are here, that we just have not worked in this space nearly enough. I think we've really been starting to learn as you all have been raising the awareness about veterans oral health. We were grateful that you helped lead some of the advocacy through Open last year with the virtual Hill Day. So I think, I mean, honestly, I think I learned a lot about the issue just through that process itself. So I'm really curious what others are learning, and I'm really grateful that Deb has come on camera and maybe has something to share or add, because you've got a great perspective.
I unfortunately don't have a success story. So we are a safety net clinic in the far northwest corner, up in where some of those lighter blue counties, several of those are at. We probably 2 years ago, we had several veterans that came in here and said, we need you to start offering care. So we went through all the hoops and got credentialed, thought we were good to go, started offering some care. We have never ever been paid for those services, not one dime. And we have just eventually written them off because we don't feel like it's fair. When they gave us their insurance, they said, this is what it is, this, and we thought we were good to go and said, yeah, we can go ahead and provide this care. That's not really right to come back on the backside. And we are, like I said, we're a safety net clinic. So, but then when we didn't get paid, we offered them our sliding fee scale discount. But that's all we were able to do because we never did get any payment.
Deb, can I ask, is that through the Community Care Network?
Is what through Community Care Network?
Like how you were registered and credentialed, how your clinic was that, so to give everybody some context, the VA can authorize private providers and systems to give care to veterans and kind of extend their benefit when a veteran can't, like when there isn't the infrastructure available for a veteran to be seen in the VA system. So maybe in Kansas, there are limited VA dental clinics. And so other dental clinics can get credentialed in the Community Care Network and serve as a provider in the private VA system, so to speak. Is that what you were talking about? And so you went through that process and then you just didn't get paid for your work?
Right. So I would have to ask our business office manager who did all the credentialing for sure. But one of the veterans who's a really big advocate came in and he said, here's all the information. This is who you have to call. This is because he has been going to Denver for all his care, which is 3.5 hours. Actually, probably closer to 4 to the portion of Denver that he was having to go to. So she took that information and made lots of phone calls, lots of contacts, and we were sent a packet. She filled that all out, got information that yes, your doctors are credentialed, you're good to go. You can start seeing your local VA patients for dental care. But then there was never any payment. So, but I can find out more information and definitely get it to you to see exactly what we credentialed through. And we're an active military provider and we don't have any problem with that. But the veteran side, we've just never been able to And we've even talked about doing, like on Veterans Day, just doing a free care. The problem with that is it's one time a year, and what would we do? Just preventative care? Or are we going to try to do some restorative care? But we have tossed that around, but we'd sure rather provide care year round and get reimbursed for it. That's what we would rather do.
Thanks for bringing that up, Deb. I want to say that unfortunately I've heard that happen before, where care providers go through the whole system to do what they can to support veterans, and then the VA takes a long time for payment. That feels like an opportunity for policy advocacy too, is if you're going through all of the proper protocols and channels to extend the work of the VA and improve and extend their infrastructure, that you should be getting paid for your time.
I guess to that point, Annalise, and this is just, showing my ignorance on the issue as I learn here, are there any policy levers at the state level at all, or is it pretty much all just at the national level?
That's such a great question because it's a yes and no. The policy changes have to occur at the federal level.
Mhm.
But the way that VA dentistry sort of works in particular is that it's a little bit decentralized. So working with your local VA and working with what's called your VISN, which is your Veteran Integrated Service Network, there might actually be some opportunities, maybe not necessarily to expand eligibility for care, but I found that VISNs sometimes have, because they're a little bit decentralized, sometimes have some flexibility in certain areas. And I think it's a great idea to reach out to your local VA and who's managing the dental care there and just have an exploratory conversation. And I say that because I've heard of some folks who partner with their VA to get their community care network like running and off the ground and getting paid for their work. And sometimes the local VA folks who are part of your region or your VISN can help grease those wheels. They can also come up with like pilot programs and stuff like that. I've heard of that in other areas, but it's so specific to your particular region.
Mhm.
I would also say that this is, when we talk about policy, there's pieces that are longer term and short term. I think that type of story, Deb, is really great to share with local legislators. It's, beyond just that this is an important issue and there are veterans in the state. It's a very real world, tangible story of how you're working to provide the care and just can't because of the red tape. And so it raises their awareness, but it also kind of gives them that fire that their local community and their local organizations are being impacted. So I really encourage you to think that through, and if there's different kind of advocacy days or advocacy opportunities that arise with those legislators, to think about sharing that story or those types of stories. Okay. Well, I know these are in here, so I hope everyone's kind of thinking through as well our other questions. I see a message coming through. Okay, yes. I'm going to look at our second question. Another piece is, as Annalise said, it's really important to us is kind of the continuum of this research work, of really understanding if there's any data gaps or kind of where the next step pieces are for research. So we would love to hear, I know some folks have already shared kind of their reactions to the data, but if you were surprised about any pieces, or if there's other data gaps that you're seeing, places that you really think need to be a research area or kind of the next step focus of where research should happen. I see some folks nodding their heads and agreeing, so I will pause so you can chime in.
Can you all hear me? Okay. So I am not from Kansas. I was excited to see this webinar opportunity come across my computer, and so I registered. I am the director of grants for the Missouri Coalition for Oral Health. And I am just really saddened by this data. I had no idea this is what it looked like. Missouri is failing horribly. We have a grade of F. So Kansas, you all are better. You all are better than us. I do have a question though about, so I was writing down the numbers, the 20 million veterans in the United States, only 1.5 million are eligible for dental care. Do you know how are those 1.5 million of the 20 million, how are they eligible for dental care and the other ones are not? Is it based like on lower ranking, like they're have a lower salary in the military, or how do you know how that was based?
Oh, Melissa, I do, but I'm not going to be able to explain it well because it's actually horribly confusing. I think that's part of the answer to that 42% of people who don't even understand their own benefits, because it's actually incredibly difficult to understand. But in an overview and nutshell, whenever you are provided a disability rating from the VA, so every veteran who has access to care in the VA, it's because they have been given some level of disability rating. So they go to a VA evaluator, and usually it's like at 30% disability rating, they are given access to kind of primary care, primary medical care. I believe there are 8 different priority groups. So based on your disability rating, so the percentage and then the type of disability that you have, you are sorted into what's called a priority group. And that really dictates the type of benefits that you're eligible for. And also if you have things like a copay associated with your benefits, and it gets pretty complicated. By and large, it's the highest priority group 1. By and large, it is veterans that are 100% rated disability that are able to access dental care. So there are some folks that fall outside of that group, but that's probably the largest. And the most recent numbers that I've seen that actually aren't published, but they were just given to another stakeholder by the VA recently, is that 85%, I think now is closer to 82%. And it's not published anywhere, so we haven't published it. But that's also because of the PACT Act. So I don't know how many of you are familiar with the PACT Act, but the year before last, I think, or last year, the PACT Act was passed, and it had to do with toxic exposures. And the result of that was that a lot of veterans were kicked into that priority group 1, where they actually do now have 100% disability rating. And so their eligibility increased to be able to access dental care. Interestingly, that utilization rate hasn't changed. So while a few more veterans, 3% of veterans may be more eligible for dental care because of that change in policy, we're not seeing them necessarily utilize that benefit.
Thank you very much. I am definitely sharing this information with the coalition, and we've talked about trying to get some kind of project going in our state. So this data is extremely helpful to prove our case, and I think we have a case. So thank you very much. I appreciate it.
I have a couple of other thoughts. One, there's a little bit of a conversation in the chat here. Barb, I'm really grateful that you told the story about trying to do a student veterans health day at the Wichita State Dental Hygiene Program. And it kind of makes me think, I mean, I always want to go to a policy level issue first, but this really is starting to make me think that maybe it's the education piece. If it's the utilization is as low as this data says, and clearly, I mean, outreach is one thing and it's super hard, but clearly there was not a lot of uptake. Maybe that's where all this needs to start. So Kathy Hunt, I'm unfortunately looking at you. She is our dental hygienist who manages and develops all of our educational programming. And we're constantly doing this. Like a population will come to us and say, we don't know how to help our population understand the importance of oral health. And so we develop a training program. So I'm almost thinking, maybe that's where we need to go with all of this first. I don't know, is that something you're hearing from other states too? And Kathy, you can say, throw me under the bus again, Tanya, come on.
So I can chime in to say, I don't know if we've heard of that specific call to action from states yet, but I think it's a fantastic one. I mean, I don't have an answer for why veterans who are eligible for care aren't getting into it. And I think that's a worthwhile pursuit, is to figure out how to not even worry about the policy piece and just get folks into care that already have those opportunities for care delivery and access.
Yeah, I'll chime in and say, I was monitoring that conversation. I think, as a public health professional, I always think education is great programming, and we'll share. I am an active duty spouse, so I don't have that veteran experience, but I do other volunteer advocacy work and other kind of military life realms, and a constant conversation that's been is being had in that space is kind of the transition and what that looks like for folks getting out of the military and moving into that veteran space. And it across the board for every aspect of life, whether it's healthcare or education or their next steps for career, is extremely confusing. And it's a very long timeline. So I would encourage you to explore maybe working with local VSOs and kind of see if they have pieces. There's definitely outreach programming. It may be an education piece on the oral health care options could be a great tie-in if folks are already kind of doing the transition piece. It's just one idea.
I was just responding in the chat, just to go back to what Annalise is saying is, if we did choose to focus on those veterans who were already eligible but not accessing, and by doing that education, we increase that access to care, then that means there's more people that we can be active with to discover, are there other barriers in the process of getting that access that may uncover some possible policy type issues that we want to work on in the future.
Yeah, I love that multi-step approach. That's also something that I always call out when we're talking about advocacy. It's always a 1-2 kind of what's next, and prepping for the resources needed once we get a certain policy through or kind of discover a piece of data. So that's wonderful. Thank you for sharing that. So I'm scrolling back up to our discussion pieces here, and please, again, this is an open conversation. So if something occurs to you about the questions we already covered, chime in. But we also want to hear, and we'll put up a poll in a few minutes here, but would love to have a conversation around resources and what would be most useful in your role or your position in advancing veteran oral health. And I think some of what we're talking here about education kind of ties into that and the questions you have. But when you're thinking through what would be helpful to you, again, this is another piece that we hear from other states. So we would love to hear what would work for you in your particular role and organization as you're thinking through what you can do to advance veteran oral health.
This is not a great answer to that, but I did want to say we're close to being ready to, we publish an annual report card, and we're a little bit late publishing it yet this year, but we're close to being ready to publish it for this year. But now that I saw the actual report card piece for Kansas from you all, I'm like, I'd really love to just incorporate that into ours. And I specifically said this year, we are not adding anything else. We can't fit anything else on the page. And now I'm like, oh, we really need to add this. Because I really think we do. I think that's, let's just start by starting to share what you already have and start to have some conversations. I mean, everybody who's in this room, we haven't had these conversations before, ever. Barbara, I'm so glad you're here. Deb, I had no idea you had this experience. There's Millie, I'd love to hear what you've got going on, because you're in Northeast Kansas, where there's a lot of veterans. Millie's a dental hygienist. We've never had this conversation. So to me, my reaction is, let's start to use the data you have, start to talk about it, start to think about it, and then that might lead us to what's next. But personally, I can't think of anything new we need other than just to start to use what you have and learn. I'm only one person in the room, though.
Well, we love to hear that. That's why we're here and why we do what we do. So that's wonderful. Did I hear someone else chiming in? Okay. Well, what I would like to do as we move into our next steps piece, Rahel, if you don't mind launching that next poll so we can gather that information there. And some of those resources, again, it could be something else, but out of education materials, policy briefs, research findings, and training modules, what would be the most useful in your role for advancing veteran oral health? And as folks chime in there and post their responses to the poll, I will pass it back to you, Annalise, to kind of share that information and talk about our next steps.
Thanks, Liz. I feel like this has just been a really fruitful discussion. And I love, Tanya, where you started, which we've adopted a motto as of late, which is what's the path of least resistance? And that feels like the path of least resistance is to just say, let's take this and plug it into something that we're already using and looking at and figure out how to just get the information out there. And then we start generating solutions, right? With more people seeing it, there's more state-based solutions available. So I appreciate that call to action, Tanya. And I'm trying to find the poll. Any last minute additions? If not, I will share the results. So I think this is really helpful too. Obviously this is a small group, and so that, you know, we're understanding that this may not be reflective of the whole state of Kansas, but resources that would be helpful to help you grasp those next steps, I'm seeing education and training. And that was a really common theme throughout all of this is, well, we don't quite know how to do the policy action yet because we don't know enough. We really need to be grounded in the work that we're doing and really kind of start with the basic foundation of seeing what veteran oral health looks like in Kansas. And I really appreciate that. And that's something that you can take back with you and your state is understanding that there's just a call for education and training and some technical assistance and support here too. So we would love to hear, based on today's discussion, as we're closing out, what was the most important thing that you learned today? What kind of stuck with you? And what do you think you might take back to as a call to action in your daily work? Love to hear that in the chat. And as you're considering that, the next steps, we are offering CEUs for this session. So the survey link will pop into your browser immediately after the session, but it will also be available on the AIDPH website in case you may have missed it. And all of the recordings from today, along with the slides, are available. So if at any point you want to rewatch today's session, you're able to do that. And all of our resources are available on our website. So Tanya shared that one of the most important things she learned was that she didn't fully appreciate the extent to which veterans in Kansas are not using their health benefits. Yeah. Deb popped in the amount of need that is not being met in our region of Kansas. Makes me rethink what we can do to deliver care, which is great. Wanted to call attention to two opportunities. As I mentioned, AIDPH engages in a lot of community-based collaboration. That's part of how we conducted this research and also how we form our educational programming. And that is the crux of our upcoming colloquium here in Chicago. So it's not too late to register, even though I know it's coming up soon in 2 weeks. So if you are wanting to come to Chicago, please feel free. But we are also going to make all of those sessions recorded and available later on our YouTube channel, free, publicly available. So feel free to peruse those, you know, in a few weeks after the colloquium if you're not able to join us in person. I also wanted to note that we have a brand new, hot off the presses report on veteran oral health and how it is essential to productivity and well-being. So hearing a lot of feedback from policymakers, from advocates, we decided to make I guess we decided to pursue an understanding around how veteran oral health actually impacts the workforce. So among veterans who are working age, are you experiencing pain? Are you experiencing loss of work and productivity as a result of poor oral health? And the answer to that is yes. And it is resulting in ultimately a financial impact to employers. So we invite you to look at that report. We think it's pretty great. And if that helps you in your advocacy efforts, please feel free to utilize that. And we will close out there today. And I will also just say as we finish out that AIDPH is here to support the work that you're doing. So if in any way we can be helpful to the work that you're starting here in Kansas, that you're continuing here in Kansas, or want to start in Kansas, we would love to be given that opportunity to support you. And so I think we are done with today's session. Tanya, is there anything you want to add?
No, I'm grateful, as I said at the beginning, we're even more grateful than ever for your leadership in this area. I think we're learning a lot. But we always know there's another group that we haven't reached, and it's kind of a smallish group today, but the engagement and the interest is really palpable in terms of how do we work with this population. So I'm grateful to you for leading the way and kind of getting the ball rolling in Kansas. So thank you.
Absolutely. Thank you for having us. Okay. Take care, everyone.
Thanks. Take care.
All right. Bye-bye.